My name is Brenda Vanderwell. I'm a physician assistant, and I have been, this is embarrassing, I've been a physician assistant since 1984, so 36 years this month.
Wow.
I know.
So how did you first become interested?
So when I started college, I wasn't even aware of a PA profession. So I was a pre-med student, kind of having a little bit of a reserve, like if I go to school for the next 8, 12 years, what if I don't like it? So I had a little bit in the back of my mind, how am I going to resolve that issue? So after my freshman year of college, I took a nanny job in Greenwich, Connecticut as a college student in Iowa. And on my way back from that summer, I had a long, unexpected layover in Chicago. And I sat next to this gal and we started talking. She's a little older than me. And she had just been to the PA National Convention. And I'm like, what's that? And she told me all about her job as a PA and what her training was. And I'm like, wow, that looks like a great fit for me. So I got back to my college. I talked to my advisor and he's like, I don't even know what that is. So I spent my time in the library, no internet, right? And found a couple PA programs within 500 miles of me, and there was only a couple. And so I set about applying to them and finding out what I needed to take my last couple years of college, and set up a couple interviews my junior year and got into school, and here I am.
Perfect.
Yeah.
Wow.
So PA program is a master's level program, so it does require a 4-year bachelor degree. And I would recommend people do health sciences. I have a minor in psychology, which I find incredibly helpful being in the health professions. So I mean, if people have the option, I would try to get some mental health training as well in your undergraduate level. And then the PA program is anywhere from 27 to 36 months, depending on the program. They require various levels of hours of healthcare experience. Like for instance, the Red Rocks program requires 2,000 hours of healthcare experience prior to applying. Some programs require less, like UC Health requires less hours of clinical training, but they have a 36-month program, so it's longer. So yeah, that's kind of the prereqs. That is the $1 million question. I think every administrative, admissions, med school, PA school in the country has been trying to figure that out. I would say the people that I see most successful have primary among their personality traits a great deal of empathy. They have the ability to care about people that they just met who may have extensive problems, but yet they have a lot of resilience. So they can walk out of the room and take on the next person, the next patient, the next problem set without being completely drugged down. I also think, and I think the admissions process does a good job of, you have to have a certain amount of intelligence. I mean, you have to be able to draw out information that you learned 10 years ago that you're like, I remember something about this, let me think about it, and be able to bring that information up. So there is a huge fund of knowledge in medicine. So you have to have that, but you have to have the humility to say, the more I know I don't know. And you have to be a lifelong learner. You have to have a passion for learning. You know, when you go through the mail and you see your medical magazine, you kind of pick that up first and go like, what can I learn from this? And you know, it's after 36 years of practice, I would say I learn something new every week, and it's just fun. It's just really fun for me. If you don't like that, probably don't do this job. So I've been out of school a while, so I had to look this up. So the range is quite a bit. It's from anywhere from 80 to 120, 130, depending on what specialty you go in. So PAs have a very broad, extensive training in general medicine. So the medical PA jobs, just like the medical MD jobs, pay less than the surgical jobs. They also have better hours and a better lifestyle, in my opinion. So surgical people, I have a person that I trained in my office who has gone on to do cardiovascular surgery. He gets paid really well. You know, he's in the 160, 180 range. He also works a ton of hours and takes a ton of call. So there's a big range. But the great thing about being a PA is at this point in time anyway, it's not so subspecialized that you can't move from one to the other. For instance, I work right now with a PA who did neurovascular surgery when she got out of school. Neurosurgery. And so that was a long hours, a lot of call, a lot of early mornings at the hospital. She went on to have a family. She said, I don't want to work these hours anymore. So she switched to family practice, took all of her fund of knowledge from training with her, as well as her experience with neurology surgery. And she's a great asset to our practice. Yeah, people are part of my life every minute of the day, pretty much. Typically come to I typically work the night before I have clinic. So I can log on to my practice environment and answer the messages, refill the medicine requests, review the specialist notes that have looked at my patients. So I'll do that for an hour or two before clinic, the night before. So that allows me to get to my clinic about 10 minutes before 8 when I see my first patient. So from 8 to 12, I'll have patients every 15 to 30 minutes, depending on what they're scheduling. If they're a procedure, a lesion removal, a mole biopsy, that'll be a 30-minute. If they're a problem-oriented sore throat, bladder infection, back pain, whatever, it's a 15-minute until noon. And then at noon, I usually take my lunch into one of the exam rooms, especially now that we're all wearing masks. Pull my mask down so I can talk on the phone and try to catch up on my messages that came in during the morning, and finish charting my morning patients. Electronic medical records has a lot of good things, but it is not time efficient compared to what we used to do with paper charts. So pretty much everyone in my office, including the young techie people, will say, yeah, they have an hour or so of catch-up time after a 4-hour clinic. So I try to get that caught up over lunch. I start seeing patients again at 1, and then I'll see patients until about 4:15, 4:30. And then I usually try to get out of the office by 6. I am free to go home after my last patient leaves the building and do all of that from home. I just find that I'm more efficient and my nurse stays with me. So if I say, oh, can you call this thing? Can you put in this referral to the specialist, blah, blah, blah. She really helps me be more time efficient. Mm-hmm. And neither of us have kids at home anymore. So we both are fine to just stay and work our box until it's pretty much empty. So yeah, so most PAs will work 4 to 5 days a week like that, full time. But one of the really great things about being a PA is it is very amenable to part-time work. So for instance, about 10 years ago, I decided I was losing my passion for this and I was a little burned out. And so I asked my bosses to go 3 days a week. And they're like, yeah, sure, do it, you know. So for the last 10 years or so, I've been working 3 days a week, which has been fantastic. I go to work with a really rejuvenated passion for it. So, I mean, I work less than a lot of people, but 50, 60-hour week is very common,
Gotcha.
Which it is for most professions, I think.
Yeah.
I love the people part. I love problem solving, and the great thing about primary care is you see the base problem. I have back pain, and you get to figure out, is it a kidney stone? Is it a degenerative disc disease? Is it a injury? Is a musculoskeletal injury? Is it a bony tumor? You know, I love the problem solving. And then I leave the surgeries and the, you know, really intensive, risky oncology medicines to other people. So I love that. I love giving people a lifeline. You know, sometimes they just feel hopeless, especially with the mental health things. And mental health in our community is hard to come by. And so, you know, their family member will bring them in, or sometimes they'll come in themselves and like, I don't feel good. I haven't felt good for years. Can you help me? And I love that.
That's awesome. And do you have any challenges along with that?
Oh, sure. Yeah. There is a lot of cooks in the kitchen in medicine these days. It's not just you and the patient trying to figure out what's best for them. Certainly you have the insurance corporations have a lot to say about what care they can and can't get, and you really have to fight to get them some of the care they need. And that's very time consuming, and it's very annoying because it doesn't feel like it should have to be that way. And I'm old enough to know it didn't used to be that way. Certainly there's the big corporations, which I now work for, UC Health, for instance, and they have a lot of things that they want you to do that may not enhance patient care, but it enhances their, you know, their corporate liability or their corporate bottom line or whatever, which also is, not as fun for me. There's certainly, if you take care of Medicare or Medicaid patients, the government has a lot to say about what you do and what you can't do, and what patients you have to take and what you can't treat and what you can treat. And I mean, there's a lot of things to keep in mind other than just that patient interaction. And that's the not as fun part to me. The billing part is very complex. I mean, everybody hires a professional biller now because if you make a mistake, you can get sued, and that's not fun. But
Gotcha. So
yes, I do. Because I've always been able to work around it. My husband has a many hour a week job, and so there are things that I didn't get to do. I had scheduled some time off to go to my middle son's Mother's Day tea when he was in kindergarten, and I was the only provider in the office that day, and the patient who came in an hour before I was supposed to leave had chest pain, had to be worked up, had a bunch of stuff to do, needed to be admitted, and I missed the tea. And I remember being really upset about it. But there was no way I was going to leave that patient, And so sometimes you have to put your job first. And, if somebody is in a medical crisis, that comes first. And my kids realized that, I think, very early on, that I would never abandon them, but I would also not abandon my patients. So there are things like that have happened. But, in my particular job, I don't take call, which is huge. Most PAs do take call. So that really helps enhance family life, because when I'm done, I'm done. I don't have to, carry a pager. So I would say most PAs feel like it's pretty family friendly. The people part. Yeah, helping people. Absolutely.
Perfect.
Yeah. I think it'll probably specialize a little bit more. Just the fund of knowledge in medicine is so huge that it's really hard to be able to be good at a lot of things. So I think we'll see more postgraduate specialty programs. There's already specialty programs in ER and ortho, and I think there's one in dermatology now, and there may be a couple others I'm not aware of, but I think we'll see more specialization. I think some of the corporate medicine people are going to want to see that you're specialty trained in your field of practice. And so it may become a requirement as time goes on. I'm not sure. I don't think the corporate part's going to go away. I don't think the insurance part's going to go away. So I do think that, those will probably continue to be tighter. The trend in medicine now is not to, for instance, reimburse people based on a visit that they saw to care for someone, but to be based on whether that person generally does well health-wise. So is their diabetes controlled? Is their blood pressure controlled? Did they get all their immunizations? And that will actually become, I think, more of a stress point between the PA and the patient, because if they're not managing their diabetes well, even though their depression gets in the way of it, or their rheumatoid arthritis medicines get in the way of it, you're not going to get reimbursed to take care of them anymore. So it's going to provide a little bit of tension, because you're like, you got to stop eating pizza every night. This is killing your diabetes. And it's killing my reproductive ability to make a living. So I think that will become an increasing part of the pie. Yes. Something I see repeatedly among young people, because I precept a lot of people. In fact, I precept PA students and train them. You have to have a passion for taking care of people, because I think as time goes on, this job will not be worth it if you don't. I mean, people go into it because they think it's a great lifestyle and it pays well. I don't think that's good enough reasons. I think you can make a better lifestyle and a better paycheck doing something else if you don't love what you do. And so, do I think everything has to be your passion? No, but I also think there should be some passion in excess, especially when you're dealing with people like this. And that's true of all the healthcare professions, and I think it's true of teaching, and I think it's true of music, and I think it's true of most professions in general. But I would discourage people from doing this if they just want the lifestyle and the money, because I don't know that those things are going to be there long term.
Perfect.